Hi, this is Daniel Picave from McKenzie Picave. I wanted to talk today about narcissism, and it's an awkward subject, and for some it can be an upsetting subject. And so I just wanted to let you know right at the start of this that possibly some of what you hear will be upsetting. And so if that's not your bag, then maybe you want to go and find one of the other broadcasts that we've done. So it stems from abuse. So, and we need to ask ourselves the question, what is emotional abuse? And emotional abuse, which is also referred to as psychological abuse, because it has psychological consequences, because it can bring on upset and trauma. And it's hard to define emotional abuse because it varies so much in how it manifests itself. But the best way to think of it is that emotional abuse is a form of bullying that is not physical in its nature. One distinction we can make between verbal abuse and emotional abuse is that verbal abuse is exactly that. It's purely verbal. It's using words to hurt someone else. And that allows the abuser to maintain some control, whereby emotional abuse serves the same purpose, control, but it involves more complex and manipulative strategies. And it's those different types of abuse and the different types of narcissism that we're going to look at in a bit more detail over the course of this broadcast. Verbal abuse then, so name calling, insulting pet names or nicknames, chubby little cherub, it's insulting. Making jokes at another person's expense that can insult them, that can hurt them, that can upset them. Sarcasm is wonderful if you're on a level with somebody who's going to understand it, but when sarcasm becomes vicious, then there's no fun in that. Speaking aggressively or violently, remaining silent in order to give somebody the silent treatment. And there's a wealth of other more elaborate abusive strategies that abusers will use in order to wear their victims down. Now, narcissists also use these tactics among many others, and we're going to explore those in more depth as we journey towards narcissism. Regardless of how it comes about, it's just not acceptable behaviour. And if you recognise that someone is using such strategies towards you, then you need to be alert and you need to watch out for other forms of emotional abuse, because you need to learn how to protect yourself and how to handle your relationship accordingly. You need to note that emotional abusers will use verbal abuse as well as some of the methods below, such as criticism. Oh, it's obstructive criticism. I'm just saying it to help you. There's a difference between criticism, which is used to hurt an individual, and genuine, helpful feedback about a specific matter. So you need to trust your instincts and your logic. If this situation arises, does it make sense that they are offering you feedback with no ulterior motive, or are they trying to gain some control over you, some coercive control? Humiliation. This can take the form of putting you down, trying to make you feel ashamed of yourself. And this can be done when you're alone with that person, or sometimes in public. Patronising you in public or when you're alone, belittling you, dismissing your thoughts, your ideas, your feeling, trivialising the importance of what it is you're saying, belittling your achievements, your interests. The abuser denies all kinds of things in order to make you question yourself and your memory. They will deny previous abuse. It never took place. They will deny conversations and events when you know full well they took place. They will deny they ever did. And this is a type of gaslighting. And we'll talk about gaslighting maybe another day. They'll treat you like a child. They'll tell you what to eat, what to wear, how you can spend your time, who you can spend it with. And these traits, these approaches, these are all common in narcissistic relationships. But what I want to do is just take a moment to let you know what narcissism is not, because there's a misunderstanding about narcissism. And the word narcissist is deeply misunderstood. It is not a synonym for vanity. It is not the same as self-love. Self-love and being kind to yourself is essential for well-being. And deep below the surface, narcissists are self-loathing and extremely insecure. So narcissism and self-love are not the same thing. The word narcissism is not a clinical term. It's a description of a set of character traits And you don't need a psychologist to recognise narcissistic behaviour or abuse. While we're dwelling on the unpleasant, what about sociopaths? What about psychopaths? We're going to come to those shortly. Domestic violence or abuse can occur in any type of relationship, and it's more often women who are subject to physical or sexual abuse. But it can still happen to men. Let's be sure of that. However, if the man is subject to abuse from a female partner, it's more likely to be emotional in nature rather than physical. Domestic violence often begins as a verbal and emotional abuse, later escalating to physical violence. In addition to physical injury, and experiencing such violence is likely to cause psychological trauma. Domestic abuse or violence can cause the victim to feel fearful of their partner, to be afraid of angering them, to feel helpless, to believe that they deserve to be hurt or mistreated, to feel guilty. And this is a false guilt that's been created by the abuser's psychological manipulation. They feel like they can do nothing right. It's common for abusers to make threats in an attempt to keep the victim in the relationship. If they have children, they threaten to take them away. They threaten to hurt them. They threaten to harm them. They threaten that if the victim leaves the relationship, there will be further harm. There will be implication. The psychological manipulation is what causes a victim to remain in the relationship and pay attention to these threats, to absorb these threats, to be guided by these threats. Abuse often follows a cyclic pattern. After an abusive relationship, after an abusive episode, the abuser will rationalise their behaviour and blame the victim. It was something they did that triggered the abuse. And that prevents the victim from seeing it for what it was. A period of normal behaviour may well follow. Everything in the garden will once more be rosy, and this leads the victim to believe that the abuser has changed. Then the abuse starts again, and the cycle repeats. So what about sociopaths? What about psychopaths? They too are guilty of damaging relationships, but what's the difference between the two? Well, clinically speaking, they're both different types of antisocial personality disorders. They both disregard the rights and the feelings of other people, but they do it in slightly different ways. They both lack empathy. They have a tendency to tell lies. They have a tendency to share the traits that are in common with narcissists. But some of the key differences between sociopaths and psychopaths are that sociopaths can feel a weak form of empathy, while psychopaths cannot. Sociopaths have difficulty in forming emotional attachment, but they can do it. Psychopaths cannot form any genuine emotional attachment, and any relationships are false and shallow. Sociopaths do not hide the fact that they don't care about how others feel, whereas psychopaths will pretend to care if it suits them in terms of their end goal. Sociopaths will be impulsive, hot-headed, experience bursts of rage. Psychopaths can be more cold-hearted and incredibly calculating. Psychopaths do not notice the distress of others. There are scales for rating the severity for psychopaths, sociopaths, and not all psychopaths are violent. Psychopaths experience loneliness. They're aware of their own behaviour, and sometimes they will drive others away in order not to put others at risk. But both sociopaths and psychopaths will use manipulation, and that will lead to the same negative effects of damaging relationships. Let's take a moment just to have a look at some of the other implications of narcissism, sociopaths, psychopaths. Let's look at Stockholm Syndrome, for example. Stockholm Syndrome is a response that a victim may have to their abuser, and it keeps the abusive relationship going. You may be more familiar with it in the context of hostages or captors, but it can also occur in abusive relationships, and many professionals will consider it a coping mechanism to help the victim deal with the trauma. In Stockholm Syndrome, The victim sympathises with their abuser and may even develop positive, loving feelings towards them. They may feel like they share a common goal. They both begin to mistrust the police, mistrust friends, family members, and others who are trying to help the victim to escape. Abusers can also show false kindness to their victims, which confuses them, especially if the victim is a child. And this distorts their perception of the relationship. It's important to be aware of Stockholm Syndrome in order to help victims of abuse who are resistant to leaving the relationship. But once the victim is safe, once the victim is out, therapy can help them recover. So what about Munchausen syndrome by proxy? This is a psychological disorder. It's a derivative of Munchausen syndrome, where an individual seeks attention by inventing or exaggerating illness. Now, in Munchausen syndrome by proxy, the individual does the same but via another person. They use their invented or exaggerated symptoms to get attention. This can often occur with caregivers, as the person's in their care. It sometimes occurs in mothers who exaggerate the symptoms of their children. Of course, the victim being treated and believing they are ill is not healthy for so many reasons, including that they themselves may develop Munchausen syndrome in adulthood due to the attention that they received possibly as a child. In addition, the abuser may try to cause harm in order to present symptoms to medical professionals. Thankfully, Munchausen syndrome by proxy is pretty rare, but it can often go undetected, and there's not a great deal of statistical information about it. The disorder shouldn't be confused with hypochondria or a genuine concern for another's welfare. So having dwelled on all those positive points, what we want to do now is start to close in on the narcissist. And let's try and understand what they are, who they are, and what the signs are that we're looking out for. Narcissism is on a spectrum. Some narcissists are almost harmless, while others are incredibly dangerous and damaging. Let's take a look at the different types of narcissist going forward. We're looking for grandiosity. We're looking for a lack of empathy. We're looking for a disregard of others' feelings and needs, validation seeking, superficiality, entitlement, rage, poor emotional regulation, and hypersensitivity to criticism. Let's start with the grandiose narcissist, because the grandiose narcissist is the textbook narcissist, the easiest type to recognise. In fact, the traditional definition of a narcissist is based on this type. They're flashy, they're successful, they're glamorous, and they display the 4 C's of narcissism: charm, charisma, confidence, cleverness. They're lavish, they're arrogant, they appear to have their lives in order, they love to keep up appearances, pleasure, power and profit makes them tick. They endlessly talk about themselves and their elaborate, flashy lives. They have anecdotes. It can feel exciting to be around them and hear tales about their world. But the moment that the attention is on someone else, they become disinterested. They start fidgeting and looking around the room if the topic of conversation relates to someone other than them. And these narcissists are unable to handle disappointment. They're able to achieve success, sometimes to a greater extent. But if they don't get what they feel they're entitled to, then a rage comes on. They're so preoccupied with keeping up the exterior, they don't like to let this dark side be seen, and they refuse to take responsibility for their own mistakes. So what about the covert narcissist, or sometimes called the vulnerable narcissist? Much harder to recognise. The one factor that distinguishes them from most of the other narcissists is their introversion. They don't like charisma, they don't have confidence. They are exactly what the grandiose narcissist is not. Their identity is all about victimhood. They're passive-aggressive, they're chronic complainers, they're sulky, sullen, and display various types of negative moods, sometimes anxiety and depression. They're hostile and irritable. They're never satisfied or content. They criticise, they judge others. They have a sense of anger which is continually simmering below the surface. Their presence feels like a heavy, dark cloud. However, the difference between a covert narcissist and someone who's just cynical is that they still have the narcissistic traits which we looked at earlier. Their grandiosity and their sense of superiority is more indirect. Instead of boasting about what they are, they boast about what they could have been. They'll say things like, "I'd have been the richest man in the world if I had a better start in life." They believe they're superior, they believe they have unrecognised gifts, and they dismiss others no matter how knowledgeable they are. In many cases, they've had a difficult past. However, they refuse to overcome it, and instead they'll complain about how the world has wronged them and say that life's not fair. They criticise anyone who aspires to make something of themselves. When it comes to verbal abuse, they're less direct than the other types of narcissists. They often make passive-aggressive remarks. They're extremely hypersensitive to any perceived criticism. It triggers their rage. And the next one in this lineup of the unfortunate is the malignant narcissist, who can be dangerous and they border on psychopath. They have all the typical narcissistic traits, except their manipulative and exploitative behaviour is more extreme. They are extremely controlling and they use what is known as coercive control. They are adept at using fear to control others. They can be cruel and menacing, frequently telling lies to protect their interests. They'll take advantage of others and bend whatever rules are necessary to get what they want. Like the grandiose narcissist, they are driven by power, pleasure and profit, sometimes to the extent of engaging in criminal activity. But one key difference between the malignant narcissist and psychopaths is that malignant narcissists experience stress when under pressure or during unsettling experiences, where the psychopath does not. Another distinction is that narcissists, even malignant narcissists, do have a conscience, albeit a weak one. Psychopaths have no conscience whatsoever. Malignant narcissists may be sexually promiscuous with the intent of having as many partners as possible. They'll also engage in compulsive or addictive behaviour. They're aggressive in terms of psychological abuse and in some cases in terms of physical abuse. Many domestic abusers are malignant narcissists. They are hypersensitive to criticism. They're paranoid and believe that everyone is out to get them. They'll make accusations about other people's loyalty and they will accuse people of conspiring against them. Benign narcissism is perhaps the least dangerous type, although relationships with a benign narcissist can be damaging. They have all the narcissistic traits, but a lesser extent. Have you ever met someone who changed the subject when you tried to ask for advice about a personal problem? Perhaps that's their friend who will cancel plans last minute when something better comes up. This is the typical behaviour of a benign narcissist. But of course there's a difference between benign narcissists and someone who's just fickle. Benign narcissists are superficial. They will not go deep into any relationships. They will pursue shallow, superficial pleasures. It's frustrating to be in an intimate relationship with one where they're just not interested in forming deep connections. Now, unlike the overt displays of attention-seeking that many of the other narcissists display, neglectful narcissists are the opposite. They are totally detached. They ignore you. They take no interest in you. They don't respond much in conversation. They make you feel invisible. They may or may not be grandiose. They're indifferent to you. If you presented them with good or bad news about your life, the response would be the same. Absolutely nothing. Trying to get the attention of a neglectful narcissist is like trying to get blood out of a stone. In an intimate relationship, their partner will have no experience of closeness with them. They'll barely feel like they're aware of their existence. The neglectful narcissist thinks they're too superior to have to pay attention to their partner, or indeed to anybody. They're arrogant. They feel entitled to ignore you. They may have colleagues with whom they interact on a more significant level, but they feel entitled to ignore everyone. So, that little insight, which I hope you found useful, into narcissists. There are a few more that perhaps we'll explore another day. We can explore communal narcissists and cultural narcissists and hybrid narcissists. But for now, that little insight maybe will help you when you're out and about and in your social circles and in your workplace, for keeping your eyes open for narcissists. They can be dangerous, they can be disruptive, and they can be damaging. Thanks very much. Hope you liked that video. If Danny Picave Counselling is something that interests you, perhaps you're going to like that video, so why don't you watch that next? If McKenzie Picave, our family law support service, is something that is going to be of some use to you, perhaps you want to watch that video. Or failing that, just get in touch, and we'll see you next time.